Vein disease is a spectrum. On one end of the spectrum are the varicose veins, which are the large, bulging, ropey type of veins. Other side of the spectrum are the spider veins, which are the small, spindly, little red, purple veins. Now you can have only varicose veins, you can have only spider veins. Most patients have a little combination of both, but they're definitely treated differently. Varicose veins are more of a pathologic, more of a medical problem. The job of the veins in our legs is to drain blood out of the leg back up to the heart, but our veins always fight against gravity. So inside of our veins we have a series of valves. These are one-way valves, let the blood travel only one direction, that's up the leg. In patients with what we call venous insufficiency in varicose veins, they have a series of these valves that fail. And so when they stand up, gravity takes over, blood starts traveling back down towards the foot, and the valves can't stop it. Now, as that pressure builds inside those veins and these veins dilate, nerves commonly are stimulated. So it's common for patients with varicoses to feel something, whether it's a tired, achy feeling, some will feel burning, stinging, itching, numbness, you have swelling, cramps, just a whole host of symptoms. There's not one specific symptom associated with vein disease. People don't know what interventional radiology is all about. But what interventional radiologists are is they're the pioneers of what's termed minimally invasive procedures. We use small catheters, wires, small devices with some sort of image guidance to treat problems from the inside, usually with just a minimal incision. The idea is to eliminate a surgery or keep patients out of the operating room. My fellowship consisted of extensive training in these minimally invasive therapies. We learn to do these minimally invasive therapies throughout the body, especially including the vasculature, the venous and arterial systems. The unique skills of the interventional radiologist really separates them from the crowd. As a diagnostic radiologist, I have extensive ultrasound training. I learned early on that really for the most accurate ultrasounds, I need to do the ultrasounds myself, so I perform them personally. Because not only am I diagnosing the problem, I'm also coming up with a game plan as I'm doing the ultrasound to try to determine what's the best treatment. So when I'm finished, I can sit down with the patient, immediately talk to them about what needs to be done and answer any questions they might have. The one thing we pride ourselves on here is continuity of care. First day you come in, we'll have a complimentary consultation, explain to you what the problems are, why you have those problems, and potential treatment options. Once treatment day arrives, you do not have different people doing your treatments. My nurse practitioner and I will be doing whether it's sclerotherapy, or my nurse practitioner will be assisting me in the varicose vein treatments. You do not have a different person every time in the office. Procedures usually take less than an hour. The great news is patients go back to the normal activity as soon as we're finished. Fortunately, most insurance companies, not all, but most do cover for varicose vein treatments because they're a medical problem. They can cause symptoms and other issues. We use the latest technologies, the latest techniques. We have state-of-the-art equipment to get the optimum result in our treatments. We have a very dedicated staff. Our office is very relaxing, a low-stress type of situation. And most importantly, one of my pet peeves is I absolutely hate waiting in doctor's offices. So we schedule our appointments such that waiting is minimized. One of the best feelings I have is when a patient refers a friend or loved one to Medicus Veincare for their vein treatments because they know they'll get best results in a very comfortable, relaxed atmosphere.